Hi, I'm Officer Eric Adams of Laconia Police Department. I want to take a moment to discuss the importance of calling 911 in the event that you come across someone who is overdosing. This is the first step you should take to call 911. Next thing I'd like to discuss with you is the House Bill 270, which is also known as the Good Samaritan Law. This grants immunity to any witness and/or victim in the event of an overdose situation by calling 911. Please call 911 as the first step. This will grant you immunity in the event that you are trying to save someone's life.
Hi, I'm Shawn Riley, Deputy Fire Chief for the Laconia, New Hampshire Fire Department. Over the next several minutes, we're going to spend time talking about opioid overdose and the use of Narcan. In an effort to reduce the number of deaths by narcotic overdose in New Hampshire, the state is making available to the public at no charge Narcan kits and Narcan administration training. We understand that Narcan is only one piece in the larger puzzle of solving the opioid and heroin epidemic in New Hampshire. The comprehensive plan to solve this problem involves education, better access to treatment, and continued enforcement. The overdoses we're talking about are caused by the types of drugs called narcotics. They include opiates, opioids. Some common names you may hear are heroin, oxycodone, OxyContin, fentanyl, morphine, and other similar prescription painkillers. Signs and symptoms of somebody suffering from an opiate overdose include shallow or very, very slow respirations, pinpoint pupils. They may be awake but unable to speak, or they may be completely unresponsive. Their skin may be pale, and you may notice a blue color around their lips or in their fingernails. Narcan, or naloxone, is an opiate antagonist. It's easier to think of it as an opiate reversal agent. This medication will reverse the effects of opiates such as heroin or fentanyl. It will not work on other types of drugs such as alcohol, cocaine, methamphetamine. It is safe to use. It has very few side effects. You can use this in pregnant patients. It's also important to understand that Narcan has absolutely no benefit in other types of medical emergencies. This should not be used for somebody suffering a stroke, a heart attack, a diabetic emergency, or anything like that. That is why it is so important that you call 911 if you think somebody is having an overdose, because it could be a different medical emergency and the ambulance still needs to come and make a full assessment. Should you come across a person that you believe is experiencing a heroin overdose, the first thing you should do is immediately call 911. The next thing you need to do is you need to assess your patient, make sure they are, in fact, not responding appropriately. If you're comfortable, the next step is to administer 2 rescue breaths by pinching their nose and breathing into their mouth 2 times. Your next step is to assemble the Narcan syringe, and then we administer it simply by inserting it into each nostril. We will give half the syringe in one nostril, half the syringe in the second nostril. At that point, continue with rescue breathing until 911 arrives. These are the kits that are going to be provided by the state of New Hampshire. As you can see, the directions on how to assemble the syringe are clearly labeled on the outside of the package, as well as calling 911. I can't say enough how important it is to call 911 should you think you need to use this kit. We open the kit. We have 2 boxes of Narcan, also called naloxone. There are gloves that you should put on to protect yourself, and there is 1 nasal atomizer. Our first step is to open the nasal atomizer, put it on the table in front of you. Our next step is to open one of the 2 boxes that contain the Narcan medication. There are two pieces here. Our first step is to remove the caps, both of those caps. This vial gets screwed into the back of the syringe and punctures the rubber stopper. Then remove the yellow cap and screw on the nasal atomizer. This is the part that fits in the patient's nostril, and the way we administer this, we stick in the patient's nostril and we squirt. Again, to show how simple it is to administer the Narcan to the victim of an overdose. Once you've completed all the steps and called 911 and assembled your Narcan syringe, I simply insert the Narcan in one nostril. I administer half of the syringe, switch to the other nostril, and I administer the other half of the syringe. And then I would continue my rescue breathing. These were some very basic steps in how to recognize someone who has overdosed on heroin or another opiate or opioid substance, how to administer rescue breathing, and how to administer Narcan. These steps are quite simple and can save a life. However, we do recommend that you take a complete full CPR course. To take a CPR course, you should contact your local American Red Cross or your local American Heart Association.